With the return to school just days away, many are wondering how they'll be able to stay open. In the week to the 27th of December, an estimated 1 in 20 secondary pupils in England, that's those aged over 11, had coronavirus. The rise in cases is driven by the more transmissible Omicron variant. Now secondary pupils in England will have to wear a face covering at least for the next 3 weeks. And the education watchdog Ofsted says there'll be no inspections in the first week of term.
Whilst 2/3 of adults have been boosted, obviously children have not. So that's why we've brought in some additional measures within schools. We're making available things like ventilators, an extra 7,000 ventilation units for those classrooms where it's difficult to ventilate.
That's largely backed by school leaders.
The biggest threat to education, it seems to me, is not having those members of staff to teach young people. And if the way we try and keep our schools more reassuringly safe is through face coverings, is through changes to Ofsted, is through improved ventilation, then that will be definitely a price worth paying.
Hi, you okay then, sir? Take a seat for me, please.
The government's clearly worried about staff absences due to COVID-19. It's asked bosses in the public sector to plan for up to a quarter of the workforce being off. It's relied heavily on an extensive programme of boosters or third vaccination doses to drive down coronavirus rates, but that's being outpaced by Omicron.
Relax your arm for me, pop it down on your leg.
And one of the key tools for keeping the economy going, regular testing, isn't working properly. There have been severe shortages of all types of tests, including the rapid lateral flow tests. Problems in accessing COVID-19 tests are increasing concerns in important sectors such as the health service. The main doctors' union here says its members are having trouble getting tests, which means they're worried that they're infecting their patients. The UK government insists more restrictions must be a last resort. But with hospitals warning COVID's placing immense pressures on them, experts say the only alternative is changes in behaviour.
Be fully immunised, take your boosters and wear a good quality mask, a FFP2 mask, and avoid those indoor closed poorly ventilated places. If we were to exercise all of those measures ourselves, we, by our own efforts, would bring down the case numbers.
For now, the only certainty is that Omicron's having an impact on workplaces around the country. What isn't known is how well the measures in place will deal with it. Nadim, Al Jazeera, London.